Hi, I'm Laura. I'm a nursing student at the University of Manitoba. Today I'm going to demonstrate how to reconstitute a med and give it via mini bag piggyback. So I just come on to shift and I'm going to go to my MAR to look at what medications I'm going to have to administer. So first is hand hygiene. And then I will look at my MAR to go through my 5 rights. So right patient is Justin Timberlake. Right medication is Zithromax, also known as azithroymycin. I have pre-pulled that, so I have that here. We're giving it a dose of 400 milligrams. The route is IV, and time and frequency is daily at 0900, which is coming up here shortly, so I will be administering that. We also would like to look at things such as allergies, so see if Justin has any allergies to Zithromax itself or any antibiotics that might cross-react because azithromycin is an antibiotic. We're giving it to him today for a respiratory infection. So then I would check his parental drug monograph. So again, the drug name is azithromycin, also known as Zithromax. It's an antibiotic and it can be administered by a nursing student. An important thing to look at is safe dose. So the maximum single dose is 500 milligrams and the maximum daily dose is also 500 milligrams. Since he's getting 500 milligrams daily, both fall within the safe range. I'm going to look at potential hazards ahead of time. So most of them are GI related, nausea, vomiting, abdominal pain. These are things that I will mention to him at the bedside. Awesome, so I will go over reconstitution and dilution instructions. So it says Zithromax supplied as a 500 milligram vial, which I have here, should add 4.8 milliliters of sterile water for injection. So I have sterile water here. I have checked the expiry date and it is good. So I will add the 4.8 of the sterile water to get a final volume of 5 milliliters and final concentration of 100 milligrams per milliliter. Since we're going to be needing 400 milligrams of the Zithromax at the end, we will be withdrawing 4 milliliters. That's just kind of a mental note. I will do that later on. Awesome, so I have my 2 vials here. I've checked both expiration dates. First thing I'm going to do is just swab the top of them to maintain sterile technique. So I'd swab the top of the vial for 30 seconds. For the purpose of the video, I'm just doing a few, but you want to make sure you get that 30 seconds. And then let dry for 15. While I'm letting those dry, I will prepare my 10 milliliter syringe with my blunt fill needle. Just lure lock that onto the top there. Awesome. So again, since I'm withdrawing 4.8 milliliters from the sterile water first, I'm going to withdraw 4.8 milliliters of air. Inject that air into my 4.8 milliliters of air into my sterile water vial. And then I'm going to flip it over and withdraw that 4.8. Make sure there's no extra bubbles within the vial there. Perfect. So there's my 4.8, and I'm going to insert it into my Zithromax here. For sterile purposes, I'm just going to recap the needle while I'm not using it.
Well, how many bubbles do you have?
Perfect. I will then take the Zithromax and roll it gently between my hands. Because it is a powder, we want to make sure it dissolves completely in the liquid we just reconstituted it with, but we don't want to shake it to the point where we reintroduce bubbles. So I will double check. Awesome, it's all dissolved in there. I will relook at this. Again, final concentration is now 100 milligrams per milliliter, and since we need 400 milligrams, we want to withdraw 4 milliliters from this vial. Since I have been playing with it, I do want to re-swab the top before I insert a needle into there. 30 seconds again, and then let dry. So I'm going to withdraw 4 milliliters of air. Flip over and withdraw that 4 milliliters of medication. Again, ensuring there's no bubbles within it. And I'm just going to recap that as I run through my second med check here. Okay, perfect. So this is at the time I'm going to do my second med check. Again, we're giving it to Justin Timberlake. Zithromax 400 milligrams, and we have determined that 400 milligrams is 4 milliliters, which I have here. We're giving it IV daily at 0900, which is coming up. And then we are wanting to dilute it in a dose of either 250 milliliters or 500 milliliters D5W or normal saline. I have chosen normal saline just because we don't have any electrolyte problems. So it's just a safe one to go with. And then we want to dilute it in a dose of 250 milliliters because Justin's not experiencing any dehydration or fluid loss. If he was, I would want to maybe up it to the 500 milliliters, but for right now I just have the 250 of normal saline. I would want to rewash my hands because I coughed on them. Now that I've done my second check, I've ran through all 5 rights. I'm going to want to place the 4 milliliters into my dilutant. So I'm going to want to swab the port for sterile technique. And then without dropping that, because we don't want to touch it to a surface that isn't sterile after we've just cleaned it, I'm just going to be very careful not to set it down. And then just insert the Zithromax there. I would recap my needle and then I would put this in the sharps container now that I'm done with it. Awesome. Now that I have that diluted into my mini bag, I'm going to label it. So I have written down azithroymycin, doses 400 milligrams in 4 milliliters, and then we diluted it into a 250 milliliter normal saline bag. So now we have 254 milliliters altogether, and we're running that over 1 hour according to the parental drug monograph. We're giving it 0900. I would put the date as well as my signature. And I'll just apply that to the bag. While I'm in there, I'm also going to go over my next 5 rights. So that's right reason. Again, he has a respiratory infection. Right education, which I will talk to him at the bedside. Right reason, and then right evaluation and right documentation. So now that I have everything prepared, I'm going to take my mini bag that has been diluted with the name tag, a secondary infusion set, his MAR, and then we're also going to take a label just to label the tubing so that people know when it was put in so they know when to change it. Awesome. And then I will have also antiseptic soap inside. So I'm just going to set these down here. So perform hand hygiene again. As I walk into the room, I do a quick safety check. Check the floors, the bed rails are up, call bell is on, my patient is not in distress, and his infusion rate is flowing at the proper rate. So awesome, everything's going good. So hi, Mr. Justin. I'm Laura, I'm your student nurse for today. I'm just gonna check his wristband. So can you repeat your name to me and your date of birth? Awesome. I would also check for an allergy wristband. He doesn't have one, and we do know he has no known allergies as of right now. While I'm here, I'm going to just check his IV site, make sure there's no inflammation or redness. Do you feel any tenderness or swelling at the site at all? Any pain? No? Perfect. I know all the valves are open, it's running smoothly, so now I will just educate him. Okay, Justin, I will let you know that we are giving you your azithroymycin today. It's an antibiotic for your respiratory infection. I will let you know some side effects is that you can have some stomach issues, some nausea, vomiting. So if you have any of those, please use your call bell to let me know. Also, if you feel any pain at the site of your IV insertion, please let me know. If you don't have any further questions, I will begin setting it up here.
Is that all right? Yes.
Awesome, so I will come to the table and I will go through my third med check.
Your name and birth date, Mr. Smith.
So again, I have azithroymycin for Justin Timberlake. We're giving it 400 milligrams, diluted into 250 milliliters of the normal saline. Again, that was 4 milliliters added, so it's 254 altogether. And we're giving it at 900 through his IV.
It is compatible with what we're giving.
So at this point, I'm going to set up his IV.
So now I'm going to find my tubing.
So before we get started, I'm just going to lower his primary infusion bag, just for gravity purposes.
We want to make sure our clamp is open, and it is.
Perfect.
So the reason why we're priming it, to make sure there's no air bubbles, so we don't give our patient an air emboli.
So then I'm going to remove his tubing. I want to make sure both of these ends stay sterile. So while attaching them, I just have to be cautious of that. So make sure I don't touch that. Make sure this end doesn't touch anything. And then insert.
So we don't want to lose any medication, so we want to prime it until we see the first little droplet of medication come out here.
Awesome.
We do. So we check. There's no air bubbles.
I would also take my antiseptic swab that I've brought in with me to clean the port. The port that I want to clean before connection is the one on the left side of the Baxter pump, because we want to make sure it's infusing through there to set the proper rate.
So you want to make sure we clean the port for 30 seconds to prevent any microbes from entering.
So I'm just going to loosen the cap here before we get started, just to make things easier.
So now we're going to put this.
So again, I'm going to take the port and just swab it for 30 seconds. Keeping both ends sterile, I will then attach them.
And to do another double check, we want to make sure it's running for 26 minutes and it lines up.
Perfect, it's
So now we're just
connected
going to
well.
start the infusion.
So what I'm going to do now is lower my medication,
Starting your medication and methyl.
open up his clamp here, and just let the air bubbles flow out.
So let us know if you get any of those.
Just to make sure there's
Well,
no
if you're
bubbles
called
in the
out here,
tubing line.
You want to make sure you get the full dosage.
Once all the bubbles are out, the chamber is about halfway full.
So make sure he takes the full thing.
I'm going to hang it here.
We'd also
Again, his label would be written there. And I'm going to set the rate. So we go secondary. We want to set it at 254 milliliters per hour. The volume to be infused is the 254 milliliters. I will then confirm secondary and start. Awesome. So I want to make sure everything is unclamped here. We want to watch and make sure we view a few drops so that we just know it is infusing into him. And I would also want to make sure that I label the tubing. Again, date, time, my initials, so that the next person who comes
And I
by
would also document
knows when this has to
on the
be
MAR.
changed.
I would write at what times we received.
Perfect, so everything's running smoothly. I will just make sure Justin is comfortable here. Again, Justin, if you need anything, I will leave you your call bell. Let me know if you need anything. I will then document what all has happened here, and come back in a little while to evaluate.